welcome back to AM Buffalo. As you all know, October is Breast Cancer Awareness Month, and today is Wellness Wednesday, and we wanted to bring in the experts to talk about breast health.
Yes, right. Joining us this morning is Dr. Nylander and Dr. Cloud. Thank you so much, ladies, for being with us, both of which are from Buffalo OBGYN, so thank you so much for your time.
Yeah, so Dr. Nylander and Dr. Cloud, let's start with one of the biggest questions that women have. I've gone through breast cancer, and one of the biggest questions, I have so many doctors. How do you differentiate which one to talk to about what, and should they all be communicating when it comes to breast health?
Well, absolutely, they should all be communicating. I would first start with your primary care physician. They're the ones who will parcel out where you go once you get that diagnosis. They will send you to the radiologist if you need additional imaging done. They will set up an appointment with you with the breast surgeon who will be doing your surgery. And from the breast surgeon, they will set up if you need an oncologist as well.
I think a lot of folks out there, they feel like, almost like because they don't know the ins and outs of their disease, that often they feel like their hands are tied and that they can't say one way or another whether or not they like their doctor, or that they're, because a lot of it is that bedside manner. I don't have another way of saying that, but do you know what I mean? What do people do if they feel like they don't have the doctor that's right for them?
Well, I would say first, you seek some advice from someone that has knowledge, and usually it is a physician or maybe even a friend. If you have a primary care doctor or an OBGYN that you feel close to, that maybe you've had some history with, give them a call and actually have the conversation about how you're feeling, what your questions are, what your fears are, and hopefully they can help you find what I like to call the right fit. Because what's a good fit for somebody is not a good fit for somebody else, and it doesn't mean that that person's not a great doctor. It just means they're not the right person for you.
Yeah. That's good. So when should a woman start getting checked for breast exams?
Breast exams, I actually started doing breast exams on 18-year-olds. I actually show them how to do a self-breast exam. I think it's important for you to be familiar with your breast, so that if something changes, you can alert your primary care physician about that.
That is so true. So we should even be talking to our youngsters. I mean, not when they first start going through puberty, because there's all sorts of things going on there. But definitely having that conversation with them as they become women, because they want to be independently doing this. Because I know for a fact, no offense to my mother, but I didn't start checking myself until way later. And with breast cancer in my family, I knew that it was important that I was advocating for myself also about getting those technological exams, not just the ones that I was doing for myself. So what do you have to say to women about that? Because a lot of us, even though it's available to us through our insurance, we kind of lapse on it. We worry about the pain. We worry about a lot of things that go along with getting checked. So what do you say to those women?
Well, I encourage all women to, number one, talk to their physician about their family history and their risk. It's important to decide who needs to start early because of the family history, and how early should that be. And you know, there's a lot of information out and from several different wonderful screening bodies that pick different ages when you should start. And I think that's always an individual decision, both with your physician and the patient. Are you willing to move forward with screening, and what are you going to do about that? But generally, I would say we recommend that you start screening for someone of average risk at age 40. And we prefer yearly, although some other screening bodies will say that that can change. Again, it's a conversation between you and your physician.
And I mean, I say they're all connected, like all of the doctors are connected, because once you, like seeing how I've gone through breast cancer, it can increase the risk of other things. And you're talking cervical and things like that, and that's where the OBs, you know, come in. Can you speak to that and just the importance of staying in touch with everyone in that circle?
Absolutely. So once a woman has been diagnosed, or even a man with breast cancer, it's important that they follow up regularly with their oncologist, with their breast surgeon, and with their OBGYN. Again, OBGYN is usually the primary care person who's parceling out, and they need to get the reports to know if you need additional screening. We're going to be doing your pap smears. We're going to be checking for other things, and to alert those other people if there's any changes going on.
And I know a lot of folks are in a place when you get that diagnosis, and when you're going through treatment, it can be a lot. So how much really rests upon you to make sure that all that information is getting out there? Because you can get a little discombobulated, for lack of a better word.
Right, right. I think that's really true. It's often recommended, especially when you get a very challenging diagnosis like that, when you go to your physicians, to take a friend or a family member to take notes, because you will forget and it will somewhat go over your head. And I would encourage all patients, if they're not sure that their doctor's getting their information, pick up the phone and call, or use the computer portal message. Almost every practice in town uses that method for communication, and make sure that your doctor is getting that information, and have a conversation if you're not sure or you can't remember.
I love that you said that. Fall upon your loved ones, right? Learn to trust that they're there for you.
And it's okay, because it's normal that you might miss something.
Yeah.
All right.
I love you ladies at Buffalo OBGYN. Can you give us some information on where you can be reached?
Yes, Buffalo OBGYN is located at 4575 Main Street in Snyder, Buffalo. Our phone number is 716-633-4575, and you can join us. We are 5 female physicians that can help you with your OBGYN care.
Oh my gosh, and that's their website up right now. So you can check them out. You'll know exactly what it looks like when you see it after you've Googled Buffalo OBGYN. And Dr. Cloud, Dr. Nylander, thank you so much for being with us.
Thank you for having us. It's a pleasure.
Fantastic conversation. I hope we continue it.
Yes,
you.
we need to.
Right.